throughout human history, people have known that as people get older, they lose their teeth. It's so much that one of the common sayings when people are wishing each other happy birthdays, they say, may you grow old until you become toothless. Now that has established loss of teeth as part of a normal human phenomenon, but it is not. It's not supposed to be. We know that people lose their teeth as they get older, but nobody ever asks why do they lose these teeth. And the cause of that tooth loss is gum disease. So this is what I want to talk to you today about gum disease. Gum disease broadly is referred to as periodontal disease because periodontia is all those structures that hold the tooth in place. When you're chewing, most people will never ask themselves, hey, what is holding this tooth in place? But actually, there are those structures, including the gum, the cement, or the glue that holds the tooth to the bone, and of course the bone. So those structures, that is the bone, the gums, and the cementum, and also some fibers that are in between the cementum and the bone, hold the tooth in place. Now, there are situations in which these structures that hold the tooth in place become infected. And this infection progresses usually very, very slowly until then the teeth become loose over time and then they start falling off. So that's really what periodontal disease is. In the initial stages, the tooth will not be loose. You will not have lost any of those structures holding the tooth in place. But there will be a lot of inflammation, so which you may see in terms of the gums becoming red. They may bleed. They may feel a bit itchy. You may see some swelling. The gums may look quite shiny. They lose the normal color, which is usually pink. But for people who have more dark color, like most Africans would do, then the gums may look a bit dark in normal times. But when there's inflammation, then that color changes to red. So basically, if you see any signs of bleeding gums or swelling or a little pain, the pain is not common, but if there is some pain, then you know gum disease has set in. And that stage, we call it gingivitis. Now, when the disease progresses, if there is no intervention, no treatment offered, then this can progress and start now destroying the bone underneath the gum. And because the gum is covering the bone, the patient will not be able to see that something is happening. Okay. So that sensation of itchiness between the teeth and the gums, and if you put a toothpick, you feel very nice, like a little bit of a relief, that kind of thing. And those are the signs of gum disease now. And then over time, if this is allowed to progress, then you lose the teeth. They become loose and start falling off. Once in a while, there might be pain. Once in a while, you might see bleeding. But most people, because there's no pain generally, they will not seek treatment unless a doctor picks it up. Of course, some of the other symptoms that people realize is the teeth may start migrating. So you get spaces where there were none initially. You may start seeing some dark triangles in between the teeth. You may also start seeing the gums, they look like they have been eaten away. So the tooth looks like it's slightly longer than normal. Yeah. You may also start seeing things like, a brown, greenish, or dark material attached to the tooth surface that we call tartar. We can talk about that later. Again, the teeth may become a bit wobbly, a bit mobile. So if you're chewing, you find the teeth are moving a little bit. Again, one of the things that may cause people to and seek help is bad breath. Very, very common and embarrassing experience. So if somebody starts feeling like, hey, your mouth is not tasting great, or somebody else told me that, hey, your mouth is not smelling nice, then you realize there's a chance that such a person has gum disease. As I mentioned before, gum disease will start initially as just inflammation of the gums only, leaving the rest of the tooth supporting structure intact. But as this gum disease progresses, if it's not treated in time, then the rest of the structures now start getting affected, and the body response is in such a way that as the body immune system tries to defend the tissues from these invading microorganisms or bacteria, then it also destroys itself. In this way, the bone gets destroyed right from the top, and as the bacteria get deeper and deeper into the tissues, then you find the bone just keeps being eaten away. And of course, over time, you can imagine if this continues over the years, then of course, as we said, we lose the tooth. And really, what is the cause of this gum disease? Because we are talking about inflammation, but what is causing it? And the thing is, as we said initially, it's an infection. And this infection is caused by bacteria. So these bacteria attach themselves, they have the mechanism to attach themselves very nicely on the tooth surface. So let's say you brush right now, and then you stay for some time. The few bacteria that are in the mouth, there are some which are adapted to attach themselves to the tooth surface. And these ones, as soon as they attach, the others, they interact with the other bacteria which are in the mouth. And in such a sophisticated way, which we can't explain all of it here, they start building up on the tooth surface. At the same time, making some creamy layer of, a very sticky and creamy layer onto the tooth surface where they interact, feeding each other. Others are good at attaching, others are good at producing byproducts which other bacteria eat on, and all that. So they really survive nicely as a family. And then over time, this amount of, these bacteria grow to a certain critical mass that the challenge they're giving to the body, or the gums and the surrounding tissues there, is so much that it's overwhelming. And at this point, that's when now the destruction starts taking place. Under normal circumstances, if you don't brush your teeth for about 48 hours, you definitely get gingivitis. Signs of gingivitis, you see the gums are red, they are very easily provoked to bleeding. Okay. And once you brush, then the signs disappear. Okay. Now, if we leave this bacteria to continue accumulating on the tooth surface for a longer period, then the progression now goes towards destruction of the bone and the cementum and the fibers which hold the tooth in place. Somebody might ask a question, where did I get this bacteria from? But as you can imagine, when a fetus in the mother's womb, it doesn't have any bacteria associated with it. But as a baby is born, then whatever method of birth or whatever, they will get these bacteria in the birth canal as they come out. And these bacteria now start accumulating on the outside surfaces. But then, after a short while, this baby will be suckling or will be feeding. And those surfaces, whether it is the mother's breast or it is a spoon, bottle feeder, the bottle for feeding babies, or whatever system is being used to feed the baby, is colonized by bacteria. And these bacteria then start colonizing the mouth. So over time, these colonies build up. And of course, as the person grows, they get in contact with many other sources share things with other family members, they share even with friends, and there are so many other sources of these microorganisms. Okay, so I think that explains the source. All right, so we've talked about the main cause for gum disease, and we say this is the bacteria that accumulate on the tooth surface. And basically, with these bacteria, not everybody gets gum disease with the same degree of severity, even though they may have the same exact type and amount of bacteria. And this is because there are some people who genetically are more prone to disease than others. And this is not unique to gum disease alone. Even other diseases like diabetes and high blood pressure, etc. So there's that inherent susceptibility to the gum disease. And the only way to know is if the doctor examines you and they're able to see probably at the rate of progression, maybe you're more prone to disease than others. That said, there are other behavioral factors that may also predispose somebody to gum disease. And top on the list is actually smoking. That smoking increases the risk for getting gum or destructive gum disease, what we call severe periodontitis, by almost a factor of 7 times. You see. So, like in the US, I think almost over 50% of the gum disease in that population can be attributed to smoking. That's a big number. Okay. So smoking is a very, very serious thing because cigarette smoking has so many chemicals, over 4,000 different chemicals, and most of those we know are carcinogenic. Okay. Some of them also cause vasoconstriction or tightening of the blood vessels, meaning the tissues are not going to be supplying blood in the normal way. And of course, blood brings in nutrition to the tissues, which brings in the immune cells to the tissues to defend itself. So now, when this is constrained, then the tissues cannot defend themselves properly. In that case, you may find somebody who has very severe gum disease with minimal bacteria in the mouth. And the only thing that will be the difference is that they smoke. So smoking tends to increase the amount of gum destruction. Now, the irony is, people who smoke, because of that vasoconstriction of the vessels, do not show the signs easily. You know, we talked about reddening, for instance, but because now the vessels are fewer and they are constricted, that reddening will not show. So in that case, the patient will say, well, me, I have no disease, because they can't see any signs. But yet, the destruction is continuing. So that's a big problem. And in fact, when somebody stops smoking, the gums may now start getting red. And so a patient starts thinking, hey, you told me to stop smoking, and now I look worse. So that's another thing to take care of. Now, there are other conditions that will make gum disease worse, such as diabetes. In fact, the mechanism of causing diabetes and periodontitis are very, very similar. Both of them are chronic diseases which involve chronic inflammation. So, in fact, in terms of treatment, if you're not treated well for the gum disease, it becomes harder to control diabetes. And if the diabetes is not controlled well, it becomes harder to treat gum disease. So they make each other worse. I know most people may not think the mouth is a big deal. I mean, even if somebody has gum disease, so what? You know, it's hidden, nobody's gonna see, and so what? But the fact is that by the mechanism in which now the interaction between the immune system and the bacteria that are in the mouth, that interaction sometimes is reflected elsewhere in the body. For instance, these bacteria can penetrate the tissues and get into the bloodstream and go elsewhere into the body. As well, these bacteria can stimulate the body to produce specific chemicals, what we call cytokines, that then circulate in the bloodstream and can go and cause problems elsewhere. For instance, it is currently established that periodontitis can affect the heart so much that somebody can get a heart attack. It has been associated with myocardial infarctions. It has been associated with preterm births, where a baby is born before the time. It has been associated with even low birth weights, so that the child born is not of the normal weight. It has been associated with diabetes, as we said, and many other conditions that periodontitis has been associated. So it is important, it has become now very clear that we need to really treat gum disease. Now, in general, when we talk about diseases of the periodontium, or diseases that attack the tooth supporting structures, they are as common as human beings are common. In other words, over 90% of the population will be affected by gum disease in one form or another. Of course, most of them will have the milder form, which is the gingivitis, where there is inflammation of the gums. But slightly above 10% of the population will have the destructive form of gum disease, which we call periodontitis. In this case, the bone is disappearing, etc. So it's a fairly common condition. Then how do we prevent gum disease from developing? The number one method that you can use to prevent gum disease is proper instructed brushing of your teeth together with flossing. So if somebody brushes properly and flosses their teeth, then the incidence of gum disease will just reduce, basically just be eliminated. Brushing is not as easy as people could imagine, because most people, they just wake up and they brush because they saw their mother, they saw their daddy, somebody brushing as they grew up. But there is a skill to brushing, and I think the best thing is visit your dentist and let them teach you how to brush. Because if you brush wrongly, either you will not remove all the bacteria, so your teeth will still be dirty, and you will be prone to gum disease, and of course tooth decay. The other option is that you will either be overdoing things and you will wear off your gums and your teeth, which may lead to sensitivity and other dental problems. So the best thing would be visit your dentist and have them instruct you how to brush your specific teeth. There are things that may make brushing a little bit more difficult, like if your teeth are not in a nice curve or they are not arranged properly, then it might be that you have difficult areas to clean. So again, your dentist should be able to help you know how to deal with those situations. When we talk about flossing, most people just show you a little thread, pushing it in and out or something like that. In fact, that movement of in and out is the wrong thing to do. Yes, dental floss is a special thread that people use to clean in between the teeth. But the movement is a little bit different. It's not in and out. It's more of up and down against the tooth. Again, your dentist should be able to demonstrate that when you visit. I think lastly, apart from personal oral hygiene, where you brush and floss, the next most important thing to do is to have regular visits to the dentist. And your dentist should be able to pick up all the signs and symptoms of gum disease or any other dental disease before they really become a major issue. And the regular visits should be timed maybe every 6 months, because dental disease can develop from very minimal to very severe disease within 6 months. That is when we always advise every 6 months have a checkup. Okay, now let's talk about treatment of gum disease or treatment of periodontal disease. In the milder form, which we call gingivitis, it is very easy to manage this because it's a reversible condition. As soon as you clean up properly, the patient brushes well, flosses, then the disease should be able to disappear. Sometimes the bacteria may have attached themselves so firmly on the teeth and may have gotten mineralized. That form we call tartar or calculus. In that case, you need to visit your dentist and have the dentist scrape that tartar off. And within a short while, a day or two, the inflammation should disappear. Now, in the more destructive phase, the periodontitis phase, then in that case, obviously, the dentist has to intervene. And usually the most common things the dentist will do will be scaling and polishing, where they scrape off all that hard material from the tooth surface and remove the bacteria which are slightly below the gum line. In more severe forms, then the dentist may have to really go deep under local anesthesia, or they may have to refer you to a specialist who deals with gum diseases, and such a specialist is referred to as a periodontist. Now, the periodontist will, with the skill, be able to, under local anesthesia, clean down deep on the root surfaces. Where necessary, they may have to operate on the gums, lift the gums out from the tooth surface, a small operation, and be able to clean the teeth properly. And if there are any bone defects, they are able to shape those out nicely so that they are more amenable to health. And then they are able to put the gums back and stitch them. And within a week, the stitches are removed and you're on your way to recovery. In very severe cases, the teeth may have been so badly affected, the patient may have to lose those teeth. It's sad that it does happen. And if it does happen, then it is important to replace those teeth. And nowadays, there are many options to replace teeth. Current trends are that people will replace missing teeth with implants, dental implants, where another artificial tooth is planted in the same spot where the previous tooth was, and it functions purely like a normal tooth. There are other replacements like bridges, and you can have dentures. Dentures are the removable type. Most people don't like them, but they can be a temporary replacement before somebody does a more retentive form of replacement. The cost of maintaining or keeping healthy teeth and gums should be very, very minimal. And the secret is, if you take care of your teeth by proper brushing and flossing, and avoid foods that exaggerate disease, such as sugary foods, which of course will cause cavities and also encourage the buildup of more bacteria, then the cost of maintaining your teeth should be minimal. Absolutely. But then we are advocating for regular dental visits, and in most places, in well-professional dental offices, consultation will range between maybe something like 2,000 to 3,000 shillings, maybe especially in Nairobi, maybe away from Nairobi, it will range from about 1,500 to 2,000, 2,500, thereabout. That's in most private practices. But in the other areas where people can also seek for dental treatment that are usually subsidized, like in mission hospitals, government hospitals, the teaching hospitals, and especially like in the teaching hospitals, people can get highly qualified very minimal costs that needs it from students. But yeah, mostly from students. But these students are usually under supervision of very highly qualified people. Gum diseases are not the only dental diseases that are common, especially in our setting. The other diseases high on the list is dental caries, which in other words is tooth decay, where the tooth develops a cavity. And this is basically caused by bacteria that consume any sugar material in the mouth, and one of the byproducts they produce is an acid. And this acid then dissolves the tooth structure. And once the tooth structure is dissolved, then of course a cavity starts to develop. And as this cavity develops, then more bacteria and food material get trapped into that cavity, and of course progressively the cavity becomes bigger and bigger and bigger. As it approaches the inside core of the tooth, where the blood vessels and the nerves are, then a person may start experiencing some sensitivity, and as time progresses, then they start feeling pain, and as this bacteria now approach that pulp, then the pulp may start swelling, and that inflammation then in a contained area then causes a lot of pain. Now once the pulp is infected, then the infection can spread into the roots, and that infection can then be released into the bone and come out through the bone and get into the soft tissues here, and that's when you see somebody with a big swelling. So that's tooth cavity or dental caries. Other diseases, of course, would include things like, of course, trauma. Somebody can get injured, they break their teeth, break the jaw, etc. Other things which are more sinister are things like cancer. People can develop cancer. In fact, as time goes on, we are seeing more and more people having cancer in the mouth, in the gums, the tongue, the palate, and many other areas of the mouth. There is cancer for the jaw, etc. And usually these, if captured early, especially if somebody has regular dental visits, they can be detected early and treated effectively. But unfortunately, most people ignore the mouth, and they tend to come when things are very, very serious. And they may have to undergo very major surgical procedures, followed by reconstruction to try and reconstruct the tissues they've lost. Others are lucky